Hello, and thank you for joining us at the Peer Assessment webinar for 2025. My name is Dana Prucci. I'm the Director of Professional Practice and Quality Assurance at CASLPO, and I've been here for almost 4 years. I'm also a speech-language pathologist, and I worked in the pediatric world, both public and private. I enjoy talking to people, whether it's for practice advice or about peer assessments. And we understand that peer assessments can be very anxiety provoking, but almost all the registrants who have been through peer assessments say it was a valuable and positive experience. Our goal today is to give you lots of information to help you through it. And with me today is Caitlin Reed.
Hello, everybody. Thank you for joining us today. I'm Caitlin, and I'm also a speech-language pathologist by background. I've been with CASLPO since May 2023 as the Manager of Mentorship and SLP Practice Advisor, and just recently joined the Quality Assurance Program, so this is new for me as well. My clinical experience is with adults with acquired communication disorders and dysphagia in rehabilitation hospital settings. Like Dana, I speak to registrants all the time in practice advice and mentorship until recently, and we're here to support you. There will be lots of time to ask questions today, but if you think of something after the webinar has ended, please don't hesitate to reach out to us. So just to keep a couple of housekeeping items before we get into the content of the presentation. As you were advised when the broadcast started, everybody is in listen-only mode. So if you have a question to ask, you can do so by typing it into the question section of GoToWebinar. We'll do our best to monitor these throughout the webinar and answer them as we're able. If there's something that we don't get to, we'll be sure to address it individually after the webinar has ended by email. Also, we may not choose to answer your question directly if it's something about your specific situation or your clinical context that only applies to you, but we'll be sure to answer you individually. For supporting GoToWebinar, it's best to close other running applications to help maintain a stable connection to the platform. If you experience any technical issues, you can exit GoToWebinar and return into the session at any time. As we said, this session is being recorded, and we'll post the video to CASLPO's website on the peer assessment page as soon as possible so that you have access to this resource.
All of the information that we'll be talking about today is on the CASLPO website. If you go on to caslpo.com and hover over the word registrants, you'll see peer assessment program comes up. Please go to that page. There's lots of information there for you. Most importantly, there's the peer assessment guide. It is in English and French, and of course, clinical and non-clinical. There's also information about the clinical reasoning tool. Actually, the clinical reasoning tool itself is on there. We'll talk about that later. There's a page with information for employers, and there's also a guide for evidence review, which is not for you. You can ignore that. So we really wanted to answer the question, which is probably on everyone's mind: why does CASLPO make us do peer assessments? Peer assessments are not a CASLPO decision, but are legislated by the Regulated Health Professions Act. All 26 Ontario health colleges have some form of peer assessments. Doctors, dentists, dietitians, occupational therapists, they all do quality assurance and peer assessments. With quality assurance, CASLPO can measure audiologists and speech-language pathologists' knowledge and skills to ensure they are meeting standards of practice in the public interest. Peer assessments can support registrants' improved practice by providing education and resources, and assist registrants to improve their skills so they can provide safe, effective, ethical care. Our peer assessors all have been peer assessed themselves and understand your experience and what you're feeling now. They then went on to become peer assessors. They go through annual training and take on a number of peer assessments over the year. These are warm registrants who want to give back to the profession and love meeting people. They love hearing about what you do in your roles. Peer assessors and this process are not out to get anyone. This process is not punitive. It can be a very positive learning experience. Registrants really enjoy talking about their roles, their challenges, and successes. It's a conversation about you and your practice. Find out more in the Quality Assurance Regulation and in that section of the website. The Quality Assurance Program is essential to support the college's mission and mandate. Regulators are responsible for ensuring registrants are qualified and competent to practice. CASLPO must act first and foremost in the public interest. CASLPO's mandate is to regulate the professions of audiology and speech-language pathology to serve and protect the public interest. So let's take a look at our agenda for today. We'll talk about what happens before the peer assessment, during the peer assessment, and of course, what happens after the peer assessment. So we'll start with how to prepare.
So you'll be matched with a peer assessor in late March or early April. Staff matches registrants and peer assessors according to your profession, your area of practice, and what language you speak, either English or French, which is why it's important to accurately complete the practice description section in your self-assessment tool. For unique roles, we do our best to match you with somebody appropriate. You'll be given the name of your peer assessor and a link to their entry in CASLPO's public register. You have the opportunity to veto one peer assessor. If you choose to use your veto, you should notify CASLPO staff within 1 week of receiving the email, and a different peer assessor will be assigned. The choice to veto a peer assessor remains confidential. Only CASLPO staff are aware that you've elected to veto a peer assessor. Your peer assessor will contact you to outline the process and to schedule a time for the virtual peer assessment. It's essential to keep both the peer assessor and the college up to date with any changes in email address or phone numbers or your contact information.
So, as Caitlin said, it's really important that your practice description reflects your role since it's used for matching. Really important on the practice description, and I don't think we need to go through it now because everyone is familiar with the self-assessment tool. Under section 8, there's a box where you can enter a description of your practice. Definitely fill that in. That will help us with matching, and it will also prepare your peer assessor to know more about you and your role. And then also at the very bottom is section 9, where you fill in your personal information, your contact information, and information on timing. Maybe you'd prefer to have the peer assessment in the summer. Maybe it's better to do in the fall. That's up to you. Looking at evidence, as always, you need to submit your SAT by January 31st, which is the annual deadline for everybody. The indicator evidence submission date is March 7th. You're uploading everything to your 2025 SAT. We want to use a minimum of 5 patient records. If you work in 2 or more places, you can have evidence from both. For instance, you might upload evidence for knowledgeable consent from one workplace and informed consent for another. Again, you're looking for something that shows that you're meeting the standard for both. Evidence can be up to 3 years old, although newer evidence is preferred. We suggest that you read the article, Tips from Peer Assessors. It's attached as a handout to this webinar, and you can also find it in the Express February 2020 newsletter before you upload evidence. Once you're ready to upload your evidence, you can hit Save, which will be at the top or at the bottom of your professional standards pages. You do not need to resubmit the SAT. For clinical registrants, evidence from patient records is key. Please don't submit any blank forms. Instead, you want to have a filled-in consent form, for example, from someone's record. It will also say on the SAT which indicators require evidence from patient records and which don't. For non-clinical, of course, you're not going to have patient records. In the virtual interview, the evidence that's uploaded is even more important because it really guides the conversation. You're going to hear us say many times today that you need to upload one piece of evidence. But sometimes if the upload references another document, like you say somewhere, see organization's conflict of interest, you can choose to upload that too. And we also recommend you use these comment boxes that are here. Why did you upload this evidence? What does it mean to you? If you upload a policy, maybe explain how you use the policy. So there's lots more information about this in the peer assessment guide, so we can take a look at that now. So there's one for clinical and non-clinical. As I said before, there's one in English and in French. And there's an appendix at the end that really shows, we're looking at the clinical one here, that really shows what types of, not what types of evidence, but where the evidence needs to be from. So it will say if it needs to be from the patient record. As I said before, one piece of evidence is all you need for each indicator, except for two. Oops, sorry, I'm just moving things around. Okay, let me go back to where we were. Sorry about that. For 1.3, which is for audiologists, and it is, I perform and document the controlled act of prescribing a hearing aid for a hearing impaired person. That one needs to have 8 pieces of evidence. You need evidence from 2 patient records that show all 4 phases of hearing aid prescription: the assessment, the prescription, the verification, and the validation. The other one that requires more than one piece of evidence is 1.5. I am accountable for support personnel providing intervention under my direction. For this one, you need 2 pieces of evidence, and the evidence should show different aspects of the supervision. Maybe it will show signing off and reviewing your CDA's or support personnel's records. Maybe it will show conversations that you have together about the patients. So those are the only 2 for clinical that require more. And of course, for non-clinical, 1 piece of evidence for all indicators. You do not need to upload the entire record. 1 piece of evidence is enough, except for those 2. There are 30 indicators. Pick the best piece of evidence that reflects how you meet the standards. Peer Assessor will see what your records are like by looking at these 20 indicators that will have things from patient records. It's also better to have 1 piece of evidence because it's better for you. You are working very, very hard now, and this is not a make work project. So if you have 1 piece of evidence that shows you meet the standard, it is helpful for you. And it's also helpful for the peer assessor. And you'll have a conversation to show what you know and how you apply everything. So I'm not going to show everybody how to take screenshots because this is in the peer assessment guide, or you can talk to a techie person. But you can take screenshots from your computer, you can take pictures with your phone and send yourself the evidence via email or text, upload the file, and then securely delete the evidence from your phone. Again, if you don't know how to do this, get some IT support. Our peer assessors suggest that if you're taking screenshots, don't upload anything upside down. In fact, we always suggest having a file on your desktop, or a folder rather, where you can keep everything. This will let you open things to make sure they're not upside down and give you a chance to rename things. So here I have my folder that I keep on my desktop, and I'm going to rename it so that it's easier for me to find what I want and also easier for the peer assessor to understand. So I have one here that is for 1.3. This is actually from patient record 1. This is 1.3 and it's my validation. I'm sure we're going to get the question, I've already uploaded and I have the patient's name. That's absolutely fine. You do not need to redo it. It's just a way that you can keep track of who the patients are and that you have 5, and also the peer assessor. In the name, it's important to use letters and numbers, but no special characters like quotation marks. The SAT has a hard time with those. So we can even look at some evidence. We get questions on, do we need to redact things? So we'll talk about personal health information afterwards, but even if you look at notes, think about what you want the peer assessor to see. It is better for the peer assessor to see a whole page of notes and just highlight the thing that's important for them, as opposed to blacking everything out so that they see a sentence or 2. So this is evidence that Fitz the cat, who's the speech pathologist, might upload for 4.3, which is I communicate respectfully and collaboratively with patients, I did again, families, registrants of my caregivers, registrants of my profession, other professions, and or coworkers and employees. So if we go back to Fitz's evidence, we can highlight what shows meeting the standard of interacting with an occupational therapist. It's fine to see that there's other information on here, like a family canceled or notes from a session, but you really want to point out, this is what I want you to look at for 4.3. And if we go now and we can actually look at how to upload things, then you can upload as a note live or recorded videos or photographs for certain indicators, such as 1.7 on health and safety. You can also take the peer assessor, if you want to take your computer around the office, you can show them where you have hand washing stations or the confidentiality where records are locked up. Very important, you do not need to redact any personal health information. The Regulated Health Professions Act supersedes PHIPAA. However, if you want to, you can. We often hear from organizations that they have concerns about uploading personal health information. If you or your employers have concerns, please call us. There is no harm in sharing with the privacy officer or your employer about needing access to files. All regulated health professions in Ontario have peer assessments, so hospitals and larger organizations will be familiar with this. You also do not need patient consent to use their files for quality assurance. Because everything is going from your phone or computer to the very secure SAT platform, it will be deleted afterwards from your phone or computer, and even at the end, you can delete the files from your SAT if it's needed, but you do not need patient consent. There is a letter to employers on the website, and the SAT is so secure, there's no need to redact information, but you can. There is an IT letter all about the security. It's very jargony. I'm happy to share it with anyone if you need it for your employer as well. So we can look at uploading some evidence now. We wanted to point out, hopefully you've seen on the SAT that some of the indicators have examples of guidance for what you might want to know to meet the standard. And there's also examples. This is not an exhaustive list, but if you have questions about what can I upload, these are some ideas. But let's upload something together. So you click on the blue required for peer assessment. A little box will pop up, choose the file, and then it takes me to the folder where I've been saving everything. This is for 4.2. So I will attach the file and then upload. And you can see here it is, handout 4.2. So we really suggest that use the comments under the professional standards. A brief description of why you chose that evidence, it can add a lot of information for the peer assessor. So maybe for this one, I will say, this is a handout I made for a 6-year-old child and their family who speak Urdu. Visuals and pictures with words in both, English and Urdu, or anything else you want to say. If you leave a spelling mistake in there, hopefully that's not going to be judged by any chance. And you don't need to write a whole essay. You're just really explaining, this is what I have and this is why I have put it in here. Okay, so let's say that I actually have better, I've uploaded this, but then something new happens and I have better evidence. Or, oops, I did something for 4.3 instead of 4.2. There's a little red stop sign beside the evidence. You can click on it. You'll get the question, are you sure you want to delete this file? Yes, and now you can upload something that you have instead. And this is something that you can do until March 7th. If the evidence does not demonstrate meeting the standard, your peer assessor may ask you for more evidence. Don't panic if you get this email. They just want to make sure that everybody is ready for the conversation. And their advice is always spend more time on the comments than on the uploads.
So the peer assessor will contact you to schedule a mutually convenient date for your virtual interview. Contact your peer assessor if you need to reschedule, although try not to change the date too much, as your peer assessor is also scheduling around their own work and other commitments. The peer assessors understand how you're feeling, as they were assessed themselves. They will likewise do their best not to change your meeting once it's booked. The peer assessors will let the college know your virtual interview date or any changes. The virtual interview for clinical assessments takes approximately 2.5 to 3 hours, but we recommend booking 3 to 4 hours to make sure that you're not rushed. You and your peer assessor will choose the virtual platform for the interview, which of course should be one that you can both access. You may want to hold your interview from one of your workplaces. As Dana said earlier, this way you can take the peer assessor on a tour and show them things in person. As Dana said, like measures for maintaining patient confidentiality at your workplace, or infection prevention and control measures that are easier to show in person.
Okay, so this takes us to our first question break. And we have some great questions in here. You'll have to give us a moment as we scan through them, but feel free to keep sending in more questions. All right, here's one. What if other healthcare professionals are involved and made decisions? Is that okay to show in the record that I upload? That's a great question. It's good to have involvement of others. And you can even consider this in terms of collaboration. And this is what your workplace is like. If you're on a multidisciplinary team, it's not just going to be an audiology or speech pathology record.
And we have another question here regarding uploading evidence for the advertising indicator. So there's a couple versions of this question. One is somebody who says they only have a small private practice and don't advertise. And this is, we would advise you to really consider anything that you have that would constitute advertising. So for example, if you have a website, is there content on the website that you may not have considered to be advertising, but would in fact constitute advertising and need to meet the standards? And think about evidence from that perspective. The other version of that question is an audiologist working for a large company indicated that their company advertises, but they don't have a say in the advertisement. We would like to emphasize that while you may not be responsible for creating the content or be involved in that, you as the regulated health professional are still accountable and responsible for ensuring that that content meets the standard, and then demonstrate that you've done that in your evidence that you would upload.
Absolutely. Okay, we've got other great questions, but we want to make sure we get through everything. So we'll take more questions if we didn't get to yours later on in the presentation. All right, so we can look back at our agenda and let's talk about what happens during the peer assessment.
So the virtual interview is really a conversation about your practice. You should have the records available from which you submitted evidence. Peer assessors may ask for different or additional evidence before the interview, but don't be alarmed if this happens. The peer assessor will discuss your evidence for the indicators and ask behavior-based questions related to some of the indicators. Peer assessors ask behavior-based questions based on risk of harm to determine how registrants or you behave in any given clinical situation. There's detailed information on behavior-based questions in the body of the peer assessment guide. It's on page 11 in the non-clinical guide and page 13 in the clinical guide and in the appendices. Behavior-based questions will be asked in all peer assessments, regardless of the evidence that was submitted. In the next section of the interview, your peer assessor will review your learning goals and continuous learning activity credits, or CLACs, from 2024. You will have added CLACs to your SAT already. For the virtual interview, it's good to upload evidence of your CLACs. So this could be certificates of completion for a course, etc. It's important to indicate your progress towards meeting the goal and the impact that this has had on your practice in the SAT. There's no right answer on rating the impact to your practice. This is your learning. It could be learning something new or validating something that you've already know. If you have accumulated or completed CLACs for 2025 already, i.e. in January of this year, you can add them in. The learning activity summary box is where you can provide additional details about the learning activity. Again, if you have evidence, upload it. For indicator 5.1, you will be discussing two documents with the peer assessor. The first is the required document, which this year is CASLPO's professional misconduct regulation, which was revised in 2024, I should say. You will select the second document to discuss. You let your peer assessor know ahead of time and choose something that's relevant for your practice. So the example that we give is that in my clinical practice, it was relevant for me to know and understand the dysphagia standards, but this wasn't applicable for Dana in the practice that she did with pediatric populations. So then last section of the interview is the clinical reasoning tool, which started approximately 8 years ago based on feedback from registrants and is used only in clinical peer assessments. It's a method of evaluating clinical reasoning through guided conversations and consists of a set of discussion questions designed to reveal the clinical reasoning that you've applied to specific cases and to promote reflective practice. As Dana said, the clinical reasoning tool and the guide are both available on the peer assessment webpage. There are also 2 mentor training modules that specifically deal with clinical reasoning. One is an overview of the tool, and one is about remediation of clinical reasoning in practice, that are both available to view on the mentorship page of CASLPO's website. The clinical reasoning tool will be applied to 2 patient records. Have 5 records available with different presentations. So audiology examples may be hearing, cerumen management, vestibular intervention, tinnitus, or cochlear implants. For SLPs, this might be language or speech, or somebody with aphasia and dysphagia. And to present, the intention is to present the breadth of your practice. 2 files will be used. You'll select one, and the peer assessor will select another based on the description that you've provided. The clinical reasoning part of the interview is audio recorded. This allows the peer assessor to write notes and review and refer to them after. It's a good idea to have the patient records available and with you during the clinical reasoning portion. You can refer to them to help you remember salient details and support the discussion. If the peer assessor finds that you need work to meet 1 or 2 of the professional standard indicators, they'll discuss the indicator with you and provide virtual remediation. For reference, this occurred for 10 people last year, and you'll likely have a sense whether this is indicated during the interview. In the moment, education and remediation is the most effective catalyst for change in knowledge, behavior, and activities. You will generate a solution and agree on the evidence required to show that you're meeting the standard with the peer assessor. This is self-directed learning, so you'll be responsible for the learning goal and achieving appropriate clacks towards it. You'll agree on a date within a short time frame, ideally 1 to 2 weeks and no more than 4, by which you can upload the new evidence. The peer assessor will summarize the remediation plan to you in an email and copy Dana. When you've provided evidence of meeting the standard, the peer assessor will submit the summary to the college. If you need work to meet more than 2 indicators, the indicator poses a significant patient risk, for example, confidentiality or prescribing hearing aids, or you're unable to generate or enact a solution, the peer assessor will write a report, which you will receive and review before it goes to the Quality Assurance Committee. So this slide provides a list of some of the SAT indicators that have needed virtual remediation recently. I'm not going to read all of them, but we did want to highlight the indicators related to record keeping, both informed and knowledgeable consent, and supervision of support personnel, as they are consistently targeted for virtual remediation.
Okay, now that we've talked about what happened during the interview, let's take another break for questions. Okay, so I see there's a few here, and I'm going to summarize them as best I can, since they all follow the same thing. What happens if something is not applicable? Do I need to upload evidence for that? So for instance, 1.3, and again, you don't need to know all these numbers, but 1.3 is about prescribing hearing aids. This is something that many audiologists do, but speech pathologists do not. So if you're a speech pathologist and you've said NA for 1 and you should say 1.3, for anyone that says NA, you won't have evidence for it, and that's okay. You do not need to upload evidence. For example, if you work for a hospital and there's no advertising, then you would say NA for the advertising standard, and that's one that wouldn't need any evidence. If, on the other hand, it's something that's a little bit unique, if you have a unique role, rather, where you don't maintain records, for patients, but you do other things, so it's still clinical, then you can, if you want, write a little description in the comment box that says, because of my role, I don't keep patient records. And again, you'll have a conversation about your peer assessor with this.
So we have somebody who has asked a question, what if you work for more than one company? Can we use evidence from both companies? So the answer is yes, you can, and you'll just want to consider whether during the virtual interview that you'll be able to have access to the record from which the evidence was uploaded.
We have a question about how recent does the evidence need to be, and can I use notes or emails from 2025? Absolutely. The evidence needs to be from the last 3 years, because showing something you did 10 years ago isn't necessarily what you're still doing now. If you have until March 7th to upload evidence, absolutely, you can do anything from January, February, or March. Again, more recent is better.
So we have a question actually that hasn't come up before and maybe needs clarification. Somebody's asked, since the interview is virtual, what is the best way to have the patient record available? My records are primarily stored electronically in a system that includes records from other disciplines, so I would not be able to screen share. So when we say that your record should be available, we just mean for you to reference, to support what it was for you to remember and facilitate the conversation. You don't need to screen share and show the peer assessor the record that you're looking at. It's really purely for you to be able to look at details in the record so that you can elaborate on why you picked that piece of evidence.
Yeah, it's called chart stimulated recall. And I can tell you that for me, I thought I knew this patient's file very well. And I was talking about it, and then the peer assessor asked me a question, and I thought, I don't remember. So because I had the file, I'm going like this because it was a paper file, I could flip through and go, oh, right. That's why I chose to use that assessment tool, because he had only been exposed to English in childcare for 6 months or for 3 months. But you might not remember it if you're stressing, and also if you have to answer things quickly. So you don't need to add on to what Caitlin said. If you have electronic records online and you want to share your screen, great. But you don't need to share your screen to talk about the patients, because the clinical reasoning tool is a conversation. And if you're concerned about having electronic records to use as evidence, then take a screenshot, and it talks all about this in the guide, or you might know some techie people that can help. All right, maybe we'll take one more. I work virtually, so how will I show indicator 1.6, ensuring materials or equipment are in working order? And I feel like we often get, I'm sure more of these, what can I upload for this one? What can I upload for that? Use your best professional judgment if it's something that shows that you meet it. So, I feel like for many people, when you think about ensuring materials are in working order, we think about audiologists who have to make sure that their sound booths are working properly, or that the devices are working properly. But there's things that you do in all practices, different areas of audiology, in speech language pathology as well. So it might not be a great answer, but I think we're going to send that one back to you so that you can figure things out. Okay, I think we'll go back to the presentation. And again, we have time for questions at the end. Keep them coming. We're happy to answer. So the last part is about talking about what happens after the peer assessment and what to expect. At the end of the peer assessment, your peer assessor cannot tell you if you were successful. That is determined by the Quality Assurance Committee. You should know how you are doing based on the conversation and if there was any remediation. So looking at what comes next, you would get a summary or a report. The peer assessor will complete one of these documents within 10 working days. Staff will let you know if there is a delay. The summary is short, and it means that you have met or exceeded all expectations. The summary does not reflect all of your work. The peer assessor will also write a summary if there is virtual remediation completed to their satisfaction. A report, on the other hand, shows which indicators still need work. This might happen if there are many indicators not met, or a high-risk indicator that requires more than virtual remediation, and Caitlin referred to those before, or if remediation was unsuccessful, the Quality Assurance Committee will direct you on how to proceed. You are sent a copy of the summary or report and have 30 days to provide a response to the committee. The summary or report will be forwarded to the Quality Assurance Committee as soon as your response is received for their next meeting. If you have no changes or comments, we suggest replying to us right away, because that way we can make sure that you get into the next meeting. Waiting the full 30 days to respond will prolong the process for review by the committee for you. The report, summary, and any information you send are anonymized. So the Quality Assurance Committee receives your report or summary, and it won't have your name, it will have your profession. Are you an audiologist or a speech-language pathologist? And it will have your peer assessment number, for instance, 30025. They will decide if they need more evidence or if you demonstrate the required knowledge, skill, and judgment. The committee meets about every 6 to 8 weeks, and you will receive an email letting you know their final decision, hopefully congratulating you for completing the process. Once you complete the process, you are not eligible for selection for peer assessment or for evidence review for 10 years. You can then choose to delete the evidence that was uploaded to your SAT. You will also get a survey from the Quality Assurance team. You may feel like you're doing these all the time, but the feedback has been invaluable and informs future peer assessments. How could the process be better if we don't hear from you? If you want to know more about this timeline, there's information on it in the peer assessment guide. We wanted to share some of the feedback we get. Again, I'm sure that most of you are not happy to be here, but afterwards, the feedback is so positive. And you can talk to other people that have had peer assessments, whether it's people you know, or you can ask us if you want to talk to someone else that's had a peer assessment so they can help talk you through it. So some of the examples we've put here, one of my favorites is the peer assessor conducted our time together like a conversation of peers. They were warm, welcoming, and professional as we explored elements of the assessment. It was respectful and helpful. And we really do get lots of comments like this. Peer assessors are called out by name. I was really nervous, but this person made me feel so at ease. And that's the idea of it. We have new peer assessors starting in 2025. These are people that successfully completed their peer assessments, and they will not be chosen for another peer assessment while they're peer assessors. And there's lots of training for this process. There's also information in previous express issues, like in 2022. Okay, that takes us to the end of the formal part of the presentation, and we are happy to spend the rest of the time remaining for questions.
Okay, so there's a question that's come in that says, I only see patients with one problem. So I only see children who stutter, for example. What do I do? The answer is, well, you may only see one etiology or one type of communication or swallowing impairment. All your patients will be different people, and think about distinguishing factors or variables. So it may be the people who they have around them, the environment in which they live, whether they are attending school or work, or what the expectations are of them. Think about how they're different and how you approach those things differently. The point is to be able to show, as I said before, the breadth of what you're doing clinically. So while it may not be a variety in terms of etiology, find a way to show variety within the patients that you see.
Absolutely. Here's one. Are the high-risk indicators just those that require multiple pieces of evidence, or are there others that are considered high risk? I love that question. And I would say, first of all, there's others. It is not just those two. And Caitlin mentioned confidentiality. So maintaining patient confidentiality is something that was determined to be high risk. It's really important, even though you only need to upload one piece of evidence for it. So don't be fooled, I'm going to say, by what needs one piece and what needs more. But hopefully you're meeting the standards for all of them, so it shouldn't even matter. But that's something that you can find out when you talk to your peer assessor.
There's another, sorry, I have my questions on this monitor, so you'll see me looking over here occasionally to see what's going on in the questions. There's another one that has come up that says, do the 5 files for the clinical reasoning tool have to be the same as the evidence file, the files for evidence? And the answer is that's up to you. They can be the same, they can be different, they can be a combination of the two and have overlap. So it's at your discretion to choose the patients to use for the clinical reasoning tool.
Just to follow up on something I said before, if you would like to talk to someone that has had a peer assessment before, so not necessarily a peer assessor, absolutely contact quality assurance at CASLPO.com. That is probably the email that you got the dreaded email informing you were selected from. You can also email me. Our emails are all over the website, and also in the letter that you received, it has our emails as well, if that's something that you want us to put together. Sorry, this is never the fun part when you get to watch us read.
Yes.
There's some really interesting questions here about people asking for their specific roles. So I see people through a consultation model or different things you do. It's one of the amazing things about being an audiologist or a speech language pathologist that not everybody does the same thing. So if you have thoughts that, uh-oh, this isn't exactly what they want, this isn't what the peer assessor wants, it's actually really great that it's going to be a peer assessment, because then you're talking to the peer assessor. So for the person who's asking about a consultation service model, so that you only see them once or twice, you can't take them through all of the steps of the clinical reasoning tool. But that's okay, because that's what your role is. And that's something that you can have a conversation about.
And I think that also harkens back to the importance of filling out the practice description section in as much detail as you possibly can, so that we're able to match you with somebody most appropriate. As we said, for unique roles, we'll do our best, but if you use the most details to consider, the more appropriate person we can match you to.
Exactly. There's a question here on matching. What if I know the peer assessor? That's a fair question. Sometimes, believe it or not, it's actually nice to know the peer assessor, because maybe you work with them, or you once worked with them and you're very far from them now, but it can be nice to have that background. Other times, maybe you don't want to talk to anybody that you know, you want it to be completely fresh. That's fine too. You do get this one opportunity to veto. I'm thinking like in MVAs, motor vehicle accidents, again, thinking speech pathologists, sorry, audiologists. But in motor vehicle accidents, maybe the person that you're first assigned to be your peer assessor is someone that has been on the opposite side of the legal issues from you. And you think, I really don't want them to be the person, because we have our relationship is a little bit contrarian. I can't think of a better word right now. So it's up to you. Hopefully you're getting the impression that we are happy to talk through things. But if you do want to veto, that's fine. The peer assessor is not given your name, so they don't know that they are going to see one person. Uh-oh, we've taken them away. They're given your name after, only after the matching is complete. There are a few questions specific to people's circumstances, so please send us an email. We're happy to talk to you after, or we'll reply to you directly after this, but I think that might be easier.
Yeah, I was just scrolling through. When somebody has just asked, when do we find out who we match with? That's done March, April, end of March,
Yeah,
early April.
yeah, exactly. So you'll get an email. And for people where these emails went into your junk folder, check your junk folder. I think that's the best advice. Just keep an eye out because you know that you're going to be looking for emails like these.
Yeah. Somebody has, so somebody's asked, is this session being recorded? How to access the recording? Yes, we've recorded this and we will be posting it to CASLPO's website within the next couple days. It'll be on the peer assessment webpage on our website. So you'll be able to watch this recording.
Currently, there are the recordings for 2024. So you'll see that it'll say 2025, and that's when it'll be those from today.
Yeah, somebody's asked, can you explain the clinical reasoning tool again? So there's a section in this presentation that goes over briefly the clinical reasoning tool and what's expected during peer assessment. So you'll be able to rewatch that. And then I would also strongly encourage you to look at the clinical, both the tool itself and the guide for the clinical reasoning tool are available on the website. So they're in the peer assessment, on the peer assessment webpage as well, and Dana had pointed to them where they can be found. I would strongly encourage you to avail yourself of those resources in advance. You can read through them and prepare before the virtual interview.
Absolutely. Okay, so I think that we'll move on and wrap this up a bit early. If you feel your question wasn't answered or you still have questions, reach out to us. We're happy to talk. So this is a little look at what the peer assessment webpage looks like. There's the documents in English, there's the documents in French, and there's information about what happens. Underneath this will be the recording of this webinar. There's also one for the evidence review, but remember, you're here for peer assessment. You want to make sure you watch the right one. We also wanted to remind you that the peer assessment is about protecting the public. It's not that the college thinks that you're bad at your jobs. In fact, we know that most of you are amazing. This is the way that we can show it to and protect the public. And if there's one final piece of advice that I think we'd like to give, it's one piece of evidence aside from those two indicators that require more. As far as what to upload, you can be creative, you can talk to your colleagues, but really use your best professional judgment.
So that takes us to the end of the content for this webinar. I think we've addressed as many questions as we can. So we'll end slightly before our 1 p.m. official end date, but we wanted to thank everybody again for joining us. We hope that this was helpful, and please don't hesitate to reach out if you have any additional questions after this webinar.
Thanks so much, everybody.